Hello and welcome to Pace Hospital's podcast. Today, we are discussing a condition that affects many people worldwide, that is lumbar disc problems. Back pain, leg pain, or even difficulty in mobility is often linked to lumbar disc herniation, a condition that can impact anyone like young professionals, active adults, or the elderly. Joining us today is Dr. Sandeep Varma, consultant spine surgeon at Pace Hospitals with extensive expertise in advanced spine care. In this episode, he will talk about what lumbar disc herniation is, why it causes back pain and leg pain, how keyhole surgery helps in treatment, its benefits, recovery, and patient outcomes. Stay tuned as we explore how this modern surgical approach is changing the way we treat spine problems. Dr. Sandeep Varma, thank you for joining us at Pace Hospital's High-Tech City. Let's start by understanding what is keyhole surgery for lumbar disc.
Keyhole surgery, also known as minimal invasive surgery, involves doing lumbar disc surgery using small incisions instead of traditional large incision.
So doctor, how is keyhole surgery useful in lumbar disc?
In lumbar disc cases, usually disc will be deep seated in the body. To reach the disc, we need to access through the muscle and bone. Keyhole surgery usually helps the surgeon to reach the disc without causing much disruption to the adjacent tissues.
Dr. Sandeep Varma, how is keyhole surgery for lumbar disc done?
Keyhole surgery for lumbar disc is done using multiple or a single small incision around less than 1 to 2 centimeters using special endoscopes or retractors and a microscope.
Can you explain how long does the keyhole surgery for the lumbar disc take?
Based on the complexity of the case and the number of levels of the disc, keyhole surgery usually lasts for 1 to 2 hours.
So doctor, what are the tests done before the keyhole surgery for lumbar disc?
Before the keyhole surgery, a screening MRI or CT and routine blood investigations for anesthesia fitness will be done for the patient.
Dr. Sandeep Varma, what are the indications of keyhole surgery for lumbar disc?
Keyhole surgery is for lumbar disc usually done when all the traditional conservative methods such as physiotherapy, medication doesn't work. Patient continues to have pain even after medication, or patient who has a weakness or any urinary symptoms and clear-cut disc disease on the MRI. In these patients, keyhole surgery for lumbar disc is usually done.
Could you explain what are the contraindications of keyhole surgery for lumbar disc?
There are usually very less contraindications for keyhole surgery, such as any severe spinal instability or any previous surgery resulting from an extensive scar around the disc area.
So doctor, what are the risks and potential complications of keyhole surgery for lumbar disc?
Keyhole surgeries for lumbar disc are usually relatively safe compared to traditional open surgery, but there will be some risk such as bleeding, infection, any neurological deficit, recurrence of the disc, etc.
Dr. Sandeep Varma, what are the benefits of keyhole surgery for lumbar disc?
Benefits of keyhole surgery for lumbar disc are less post-operative pain, early discharge from hospital, faster recovery, and early resumption of daily activities.
Can you explain how successful is keyhole surgery for lumbar disc?
Keyhole surgery for lumbar disc has a relatively good success rate, especially done in a good center with an experienced surgeon. Keyhole surgery has around 95 to 99% success rate in lumbar disc disease.
How long is the hospital stay after keyhole surgery for lumbar disc?
Typically, for a keyhole surgery for lumbar disc, hospital stay lasts from 1 to 2 days only.
So doctor, one final question. What are the precautions required post keyhole surgery for lumbar disc?
Post-surgical precautions for the keyhole surgery of lumbar disc to be taken by the patient are resumption of activities as advised by the doctor, avoiding heavy weightlifting and strenuous exercises, and taking a good wound care. This is the comprehensive overview of the keyhole surgery for lumbar disc disease.
Thank you, Dr. Sandeep Varma, for sharing valuable insights on keyhole surgery for lumbar disc with our listeners. Dear listeners, if you are experiencing persistent back pain, leg pain, or mobility issues, don't hesitate to consult a qualified spine surgeon. Early diagnosis and right treatment, like minimally invasive keyhole surgery, can make a huge difference in recovery and quality of life. We'll be back soon on Peace Hospital's podcast with another informative episode. Until then, take care, stay active, and stay healthy. Thank you.